Good morning, everyone. Welcome to one of our very anticipated webinars the Chamber of Commerce is putting on navigating COVID-19. It's presented by our healthcare committee and the Miami-Dade College Medical Campus President, Dr. Bryant Stewart, and FIU's Dr. Eneida Roldan. Both of you are really tremendous leaders, and I really thank you. We're very lucky to have you leading our healthcare committee, and you've put together a tremendous program today. So we're all looking forward to that. I'm Alfred Sanchez. I'm the president and CEO of the Greater Miami Chamber. Today's session, you know, the Chamber is a private organization. It's not funded by the government. We have to really rely on the generosity of our sponsors and our members. And today's sponsors are United Home Care and FIU-Health, both organizations which have helped my family out personally with the care of my mom and dad. So I want to thank them. Listen, we have a really important discussion today with some distinguished panels. We're very lucky in Miami to have some of the top national experts in infectious disease and control. And they're going to speak to us really to try to get us to understand the current situation. How do you interpret the statistics? It sometimes feels like, you know, the same set of numbers are being used to argue different sides of the fence. So, you know, I'm looking forward to that. You know, we've been talking about the FDA vaccination approval. Well, what does that really mean? And what about this booster shot? When's it coming? Do we need to get it? How do we tell? Today is about ferreting out the facts from the rumors and misconceptions so that our business leaders can really have facts and data to guide your business in this new reality, let's say. So listen, and we're going to be here for the foreseeable future. So I think it's an important discussion today. I'm really looking forward to that. Before I turn it over to Dr. Roldan, let me go through the mechanics of our meetings today. As you see, we're all are going to be on mute. The chat is open. The Chamber of Commerce is about networking with each other. We really encourage you to use that to do so, to share information with one another. Keep an eye on that chat because we'll be dropping links to important links to information that you'll want to keep for later on. If you have a question, and we encourage your questions, these sessions are about getting your questions answered by top experts. Use the Q&A feature. Dr. Brian Stewart will be looking at that later on and ferreting out and forwarding those questions to our panel. All right, so before we get to the show, let me give our important sponsors a chance to come up and talk about their organizations. Both of them, as I said, are extremely important organizations, healthcare in this community. First, let's hear from United Home Care, and let's start with this video. Let's roll the video.
Hello, Chamber members. My name is Carlos Martinez, President and CEO of United Home Care, the proud sponsors of today's event called COVID, What's Next? Today we will hear from researchers and experts that will give us an update on the vaccines, the variants, and what we need to do to get our businesses back open and getting people back to work. But before we do that, I want to talk about COVID, what's now? On August 23rd, the FDA approved the Pfizer vaccine. Soon, the Moderna vaccine will also be approved, God willing. With that vaccine, we have the ammunition to fight COVID, get our businesses open, people back to work in a safe environment, and getting our economy back in order. So stay tuned and listen to our experts. Thank you. Get vaccinated.
Well, thanks to my friend Carlos there, who's really been an incredible leader in this fight. Up next, we have Dr. Bhavarth Shukla from the Medical Director of Infectious Disease Control and Employee Health at FIU-Health, University of Miami Health System. And before Dr. Shukla says a few words, he wants to make sure that we see this video.
At the University of Miami Health System, we have been at the forefront of COVID-19 vaccine testing and rollout.
Leading clinical trials to make sure it's effective against the virus and it's safe.
We know the science, and we know the sooner you get vaccinated, the sooner we can all go back to normal.
Get your vaccine to protect your family, friends, and our community, and encourage your loved ones to do the same.
Dr. Shukla, I think you had a few words to say.
Yes, hi, good morning. And thank you so much to the UN Communications team and the Chamber of Commerce for inviting me to give remarks. I think my video is loading. In addition to patient care, one of our goals at the university, as well as FIU-Health, is to expand knowledge through research and teaching. And as you saw in the video in this regard, we've worked very closely with community leaders over the past year and a half in a variety of settings to understand everything from epidemiology and surveillance, vaccinations, to diagnosis and management of COVID disease. And yet 20 months into the pandemic, we're continuing to be humbled by the challenges that we face with it. And all the research that has come out of this, just as with other pandemics, some key themes continue to appear, most important of which is appreciation that our personal choices can have significant effects on those around us. This theme is highlighted by studies which have demonstrated the importance of staying home and isolating when sick, efficacy of masking in mixed company, indoors, and crowds, and most recently, the importance of getting vaccinated. While most of us think of these measures as ensuring personal safety, it's really the importance of these measures ensuring the safety of those around us that can strike a chord with our humanity and help us enact change in the trajectory of this pandemic. We're truly integrally connected as a community and as a globe. And if our society is able to find a right balance between fear of the virus and overconfidence in dealing with it, we'll be able to see our way through it to the end of this. So let's work together and continue to understand more as this pandemic progresses so we can find a way out to return life to normal. Thank you.
Thank you, Dr. Shukla. Those are wise words, and we all look forward to someday getting there, but something tells me that we're not going to see this virus in the rear view mirror, so we have to really do our part to keep the numbers down. Thank you to FIU-Health really for not only the sponsorship today, but for being such a tremendous leader in this community, and especially at such an important time of man, really. I want to shout out to my good friend Mirna Vaca, who is the Director of Community Relations at FIU-Health. She's a board member, executive committee member, and has been extremely active and extremely helpful with the chamber and leadership there. So thank you, Mirna, for being a part of this. Now, it's my pleasure to introduce to you a great friend, the Vice Chair of the Chamber of Health Committee, Dr. Eneida Roldan. Dr. Roldan is the Chief Executive Officer of FIU's Healthcare Network and serves as the Associate Dean for International Affairs for the Herbert Wertheim College of Medicine. Dr. Roldan is the immediate past Chief Executive of Jackson Health System. Her training as a medical doctor has taken her throughout the Caribbean, Central, South America, and Asia. She's achieved academic honors in multiple institutions, including USF, University of Tennessee, and the University of Pennsylvania Wharton School of Business. We're really, truly blessed to have you, Dr. Roldan. The floor is yours.
Good morning, and thank you so much, Alfred, for that kind introduction. It is truly a pleasure to participate today in this exciting and timely seminar, especially in the company of my esteemed colleagues, Drs. Abbo and Dr. Marty. In addition, it is an honor to serve as the Vice Chair of the Healthcare Committee for the Greater Miami Chamber of Commerce. December 2019 is a date the world will never forget, a date that disrupted the world across every aspect of our lives in more ways than one. In Wuhan, China, a novel virus surfaced, COVID-19. The world watched as this novel virus developed and traveled from country to country across the globe, inflicting disease and causing death. A pandemic was upon us. No country has been spared as of April 2021. Even countries such as Thailand and Vietnam that pride themselves on successfully containing the virus since the pandemic began have had surge of cases. Only a few countries and territories in the South Pacific and Central Asia have been spared as of September 1st, 2021. For the past few months, the globe has traveled the Greek alphabet, alpha, beta, gamma, the deadly delta, and now most recently, still a variant of interest, not of concern, mu. The world watches our elderly population perished, and now we watch as our children are impacted by the Delta variant. Fast forward 20 months, the world has seen 221 million plus confirmed cases, 4.6 million deaths. Right at home, the US has seen 41 million plus confirmed cases, 669,000 total deaths. In our home state, Florida, considered a hotspot, has had its share of the most current count of 3.4 million confirmed cases and 47,000 deaths. Even close to home, our own county has had 635,000 confirmed cases and 6,500 deaths to date. The stats are astronomical. The number of resources consumed is exponential, and the loss of lives is regrettable. Yet even more regrettable is the fact that even today, we have more resources to fight this virus. We still have a large number of cases. We have more testing, treatment, and vaccines. However, we have not been able to convince populations that vaccines do work. We fight not only the virus, but the myth and misinformation on an non-evidence-based treatment and scare tactics that ultimately impact the health of the population. There is still hesitancy in getting vaccinated. The latest numbers in Florida of fully vaccinated is 54%, and in Miami-Dade County is 68%. Still not enough to get us to herd immunity necessary that may have prevented the impact of what we see today with the Delta variant. So we as scientists, physicians, frontline healthcare personnel ask ourselves, why? Today, I am joined by two esteemed colleagues, Dr. Lilian Abbo and Dr. Eileen Marty, two experts on COVID. They need no introduction. However, I would be remiss not to mention some of their accolades in the field of pathology, infectious disease, and immunology. First, Dr. Abbo. Dr. Abbo is a professor of clinical infectious disease at the University of Miami Miller School of Medicine and core faculty in infectious diseases for the Miami Transplant Institute. Dr. Abbo is the chief for infection prevention and control and antimicrobial stewardship program for Jackson Health System. Dr. Abbo has over 30 publications in peer-reviewed journals and book chapters and monographs. She has given over 100 oral presentations and more than 50 abstracts in national and international meetings in the areas of antimicrobial stewardship, antimicrobial resistant, and transplant-associated infections. Good morning, Lilian. Next is Dr. Eileen Marty. Dr. Marty is an expert in infectious disease and disaster medicine. She served as a naval officer for 25 years and has more than 40 years of clinical and research work in the fields of tropical and infectious diseases, public health, outbreak response, and mass gatherings. Dr. Marty serves as a public health advisor for the South Florida community. She has also worked with the World Health Organization and has responded to disease outbreaks around the world, including Ebola, Zika, and most recently, COVID-19, serving as an advisor for the South Florida community. It is truly a pleasure to welcome my two colleagues, Dr. Abbo and Dr. Marty. So, Dr. Abbo, the floor is yours.
Good morning. Let me share my screen. And first of all, I would like to thank Dr. Roldan and the Greater Miami Chamber of Commerce for this kind invitation, and for all of you for taking the time out of your busy schedules to listen to us today. I know how hard this pandemic has been, and I just want to share a little bit of the bird's eye view of how we see the world and how we have been dealing with this pandemic throughout the front lines. My experience at the university and at Jackson Health System, as well as guiding Miami-Dade County along with Dr. Marty in all the front line experience when we started to prepare in January of last year, and how we work with the county mayor and the governor and the state, try to guide and provide our expertise. As all of you know, and as Dr. Roldan very nicely summarized, this world and this pandemic has changed our world. It has challenged our lives. It has challenged our economy. It has challenged our workforce. And when we all thought we were prepared, then the next wave came. And then when we all thought things were getting better, another wave has come. So the workforce is tired. Many of us have had challenge with mental health and anxiety, and all of you as business owners have to deal with your own businesses and the people that work for you, and empowering people to continue to promote the economy, and at the same time their families, and how we all deal with this. The infections range from people who are completely asymptomatic and say, I never knew I had COVID, I had a mild cold, to people who have actually died from this disease. So we've all learned that we need to really be humble, that we can never say this is just nothing, because you never know who's going to be hit next. The same time that we have a pandemic of infection, we have a pandemic of misinformation. There is a lot of confusion and mistrust, and we're going to talk today how we foresee we can tackle some of these issues. Our knowledge and guidelines have constantly change, but they continue to improve and continue to evolve. And we have all learned that in this pandemic, you have to learn to adapt, you have to be very nimble. Early in the pandemic, when we were starting, the information was changing every 3 hours. We would start our day very early with a plan, and within 6-8 hours, everything would have changed. So now the information is, again, spreading. The information is not changing that often, but I know there has been a lot of confusion. Wear a mask, do not wear a mask, buy toilet paper, do not buy toilet paper, ivermectin and azithromycin, and now the monoclonals, and then the vaccines. So we're gonna be talking about that today. Unlike many of you, this pandemic is very personal to me. It has infected my family. We had a death in our family very early on, my mentor and my uncle, who was also a physician. And I was the only person who could be at bedside when he was infected in the intensive care unit, where people were even afraid to going in and bring him food or even clean the room. And this was very early in the pandemic, where we didn't have much information on treatments. And I wish we had a vaccine back then to protect him and to protect all our family. It has also affected close friends and physicians who have died from this disease, nurses who have been critically ill while taking care of other patients, and colleagues who have been sick and again recovered. So this is very personal. And I want to end with a message of hope, that although this is a horrible disease and has affected all our lives, we all need to come stronger and together. It's the only way we will tackle this pandemic, and we need to come together globally, not just in our neighborhoods or in our community. This is a world problem, and we all need to do our part. I want to share with you this video that was originally sent to me through WhatsApp in January 25th of 2020. One of my dear colleagues has some collaborations in Wuhan, China, and this was the emergency department. This is while the world was telling us this is just a cold, nothing is really going on. So as we saw these images, we started to think, hey, this is not just a cold, and I hope it doesn't get here. This is the world a few weeks later, on March 11 of 2020, and still here. A global pandemic had not been declared. There were about 631 total deaths in Italy and about 4,373 deaths in the world, with over 100,000 cases worldwide. China and Italy and Iran were leading. As you can see here, the US had only 1,000 cases back then. And we had a conference call with one of our colleagues in Milan. And at that time, we were fully prepared. We had a whole marching order here at Jackson, how we were going to handle the pandemic. And we were just about 2 weeks behind Italy, according to our colleagues there. And they said, no matter how well prepared you think you are, you have no idea what's going to hit you. We feel like we are at war. And those were the words of our colleagues in Italy. I went down to our C-suite and I said, we thought we were prepared. We need to prepare even more. And I mind you, we were preparing since January. So at that time, we started really looking again carefully at what other things we were not thinking about, learning from the experience of our colleagues in Italy. And I was told by one of our leaders, you don't have to worry so much. There are no direct flights from Wuhan, China to Miami. And also, maybe not so many people will travel from Italy, right? One of the areas where we cover at Jackson are the jails. And my concern was, how are we going to prepare the jails? If we have an outbreak in our correctional facilities, it's going to be catastrophic. And I was told, well, people don't go from Italy to the jail, right? People that we usually have in jails are not that kind of people. The first case we had to rule out COVID in the jail was someone who was arrested by immigration arriving from Italy. So one of the messages here is, when you're preparing for a crisis, you need to fully prepare and think of the unexpected, because you think things are going to come through the front door. They don't always come through the front door knocking. They may come through your backyard. So that's one of the lessons we have learned. And then, as you all know, the history, Italy had to be temporarily closed. And where are we today? Well, those numbers that we were a bit worried in March are history. And look where we have over, 4 million deaths around the world. And even though we have administered 5 billion doses of vaccines, we are nowhere near in many parts of the world where we need to be. Unfortunately, the US is leading with the number of cases and the number of deaths around the world. And within the United States, unfortunately, Miami-Dade County and Broward are in the top 10 of this hit parade. Twice in the course of the last 20 months, we have been the epicenter of this pandemic. Nothing to be proud of. The deaths of COVID in the United States have surpassed the number of deaths in the US from World War I and II together. And we are about to, unfortunately, surpass the number of deaths from the influenza pandemic in 1918, when we didn't have the knowledge, we didn't have the vaccines, we didn't have the technology that we have today. COVID has also surpassed the number of deaths from many other causes in the United States, including heart disease, cancer, stroke, and diabetes. So, as you can see, this is a serious problem. And it affects us as healthcare workers and affects you as business owners and the economy. When you look at the number of deaths in Miami-Dade County, we also know that if you can see in the bar, in the gray bars, these are a number of deaths that have happened. When you look at July 1st, we didn't know that there were deaths around that day. There were no deaths reported. However, when you start seeing the way data is transmitted, there is a delay. So even when you see today, September 8th, there are no deaths, it could be there 2 to 3 week delay in reporting deaths and other outcomes. And there are many reasons for this to happen, including deaths that are reported outside of the hospital and how are deaths attributed. So what we have seen with this fifth wave with Delta is a significant number of admissions, hospitalizations, and then we see increase in ICU admissions, and then a really surge in the number of deaths. Really, really worrisome, because last summer when we had this surge in Miami-Dade County, we didn't have vaccines and we were fighting with people to continue to wear a mask. Now we have vaccines, masks, and we know with science what has worked, and here we are still trying to convince people that science works. The pandemic is not over. As you can see, the global numbers and in the last 7 days and the cumulative cases, and again, the number of deaths, cumulative deaths around the world, it's really striking. And I'm trying to move my slide. And in this synopsis provided by also Miami-Dade County and the state of Florida, Miami-Dade County today is reporting about 9% positivity rate, but in the state of Florida, we're still over 15%. This was last week, we were around 19%. So there continues to be a high transmission, and we still have not vaccinated enough people, especially the younger population. So these are still issues that we're monitoring closely. This is the numbers are improving slowly, but they're not where they were, nearly where they were back in May or June. And again, this shows the positivity rate in our previous weeks and the number of deaths. And as you can see, again, vaccination in the younger population, it's much less than the population that it's 65 and above. And we need this as we're opening our schools, and we want our kids to have normal development. Unfortunately, what we have seen also with this wave of Delta is the pediatric number of cases that are requiring medical care and hospitalization has increased. So one key message is earlier in the pandemic, there was some misinformation that children did not get sick. And we know that this disease affects everyone, regardless of your religion, your race, your skin color, or your age. Children do not tend to develop as severe disease as the older population. However, we have continued to see an increase in the number of hospitalizations, and we are also seeing this maternal deaths that we were not seeing with previous waves. So as you can see here, pregnancy continues to be a risk factor. For children, there is no one condition that it's a risk factor. Pretty much children are at risk, for this disease, even when they don't have any predisposition. We're also seeing in the front lines children that are acquiring this disease from parents that were not vaccinated as early as 6-year-old, 4-year-olds, and newborns. We've had babies that were 1 day old and they had in utero transmission because the mother chose not to get vaccinated. We have newborns now intubated in the intensive care unit, something we were not seeing a year ago. So this is serious, and one of the key messages is we need to continue our efforts to vaccinate our children, and we need to continue our efforts to vaccinate pregnant women and cocoon that family and protect others, especially when we don't have vaccines yet for kids that are 12 and under. Vaccinating the rest of the household is as important to protect everyone. And this is just to show you how the lungs of a patient with COVID look like. Your lungs should be pretty much black or dark, and all this white, it's really this virus that it's taking over and causing a massive inflammation. Many people fear the vaccines and the side effects, but they don't think of the chronic sequela that this infection leaves, including fatigue and shortness of breath and pulmonary fibrosis, which is your lungs get very stiff. And this is extremely important. People need to understand that this is not just a cold, that this virus leaves sequela, and we're just learning for how long the sequela are going to last. I just want to give you a brief overview of how we dealt, at Jackson with the pandemic. And as many of you know, Jackson was founded in 1918 with the flu pandemic. And as the director of infection prevention, I oversee 3 acute care hospitals. Now we also open West, so now we have 4. We also have behavioral health, rehabilitation, 2 long-term care facilities, 5 urgent care centers, and 3 of the Miami-Dade corrections facilities. And over 12,000 employees and 500 University of Miami faculty. So I oversee the infection control and antimicrobial stewardship program across the health system. And we had to mobilize resources across all those areas. We had to collaborate with our airports, with our ports, very early in the pandemic, working on the testing sites and the drive-through sites. And again, continuing to support and ensuring that our healthcare workers had personal protective equipment, have protocols and measures to provide treatment, and knew how to take care of every patient safely, because the lives of our healthcare workers are as important as the lives of the patients that we care for. We had to plan, we had to prepare, and very importantly, we had to adapt. And we had an operational and a clinical side where we had to make sure that we take care of the people, that we had the right products on the right places. And on the clinical side, we had to triage, we had to test, we had to trace, and we still continue to treat. And our goal in 2021 has really been continue to vaccinate, including making it mandatory for all our healthcare workers. If we're going to be taking care of people, we need to protect ourselves, and we need to ensure that our workforce understands that. I'm not going to go in detail into this, but this is just to show you how the leadership response team was developed. And this is everything that went into place, from procurement and ensuring that the supply chain was getting the products where we needed them, that we had enough ventilators, that we continue to have enough masks and personal equipment. We ran out of soap at some point and hand sanitizers. We had to continue working on that, and all those shortages have completely resolved. We need to work on laboratory testing and ensuring that we have the right supplies and testing people at the right time. And again, every person in the healthcare system, from engineering to health system leaders, has been part of this response, and we have not stopped. This for us has been a 24/7 operation for the last 20 months. We have been forecasting what will happen. And again, there's the worst case scenario and the best case scenario. And as you can see, this wave right now in the summer has mirrored very closely what we saw the last summer. To me, Miami-Dade's weather and conditions, our summer is the winter in the rest of the country. We tend to be more indoors. We have air conditioning. It's very hot outside. We have tourism coming over. People are traveling, are mobilizing. So coincidentally, it looks like there is some seasonality between last summer and this summer, including also concerts that we're giving in Hard Rock Stadium, where we saw that right after that concert, the cases really started to peak. So I want to make sure that you as business owners understand that while we're trying to keep the economy open and we want everyone to have a new normal, every decision that you make also has an impact in the number of cases, hospitalizations, and deaths that we're going to see across our cities and across our state. I want to reinforce the message that there is a lot of information. But if you're going to look at something, please don't go into Facebook or TikTok. Go into the NIH website, the Infectious Disease Society of America website. There are over 6,000 clinical trials going on from 700 that we have over a year ago. There is good science and there is good information out there. And again, Dr. Marty and I are always available to answer questions. But please, if you're going to spread messages, make sure they come from a reliable source, and do not spread myths. The vaccine does not have a chip. The vaccine is not going to, change your genome and affect us. I think that's really, really important. Somebody asked me a few days ago if we're going to end up like the Will Smith movie where everybody ended up becoming a zombie because we get so many boosters of the vaccine. That it's not true. And I really hope that you understand that one thing is Hollywood and science fiction, and another one is real science. And I'm going to pause here, and I'm going to let my esteemed colleague, Dr. Marty, take over.
I didn't realize I was on mute. Dr. Abbo, that was a phenomenal presentation. Thank you so much. Let's get on with this. And first of all, I just want to remind everybody, please don't call it a virus called COVID. There's no such thing as a virus called COVID. The virus is called SARS-CoV-2. That's the virus that is causing in some people a disease called COVID-19. Do not confuse the virus with the disease, okay? And this is typical of all infectious diseases, that some people manifest nothing and some people manifest mild, moderate, or severe disease. That is typical of infectious diseases, a fundamental tenet of infectious diseases. So it's absolutely true in this case as well. It's also important to know, you saw the phenomenal numbers that Lily just gave you. I want to point out that the fact that this is so transmissible is one of the key reasons that we see so many cases. Because when something is not very transmissible, you end up not being out and about where you can share the virus. So we compare the original SARS outbreak in 2002, which had a higher percent death rate, right, of 9.19 than does the SARS-CoV-2. The total number of cases is relatively small. If you compare that to MERS with an even higher percent of people who died, again, very few people actually get sick, so the total number of deaths and disease is much lower. Whereas with this virus, with a much lower percent of the people who get infected dying, we have an outrageous number of deaths, 4.5 million, as Lily showed you in her slides. Let's remember too that viruses are part of the circle of life. So what we're talking about here is a One Health disease, a disease that is affecting over 500 different species of animals, not just human beings. And that the SARS-CoV-2 virus is a member of a huge group of beta coronaviruses that we knew back in 2007 were a ticking time bomb for causing a global pandemic. So this is not news to those of us who've been studying coronaviruses for a long time. And there's an interconnectivity to our systems. So you have to think of the fact that the social determinants of health are going to affect people, are going to affect and the economy affects the people, and the social, it all goes back and forth. The environment as well as being affected by this, as are animals. So what are the economic impacts of this COVID-19 pandemic? Well, I think everyone here is clearly aware of the devastating loss of life, but there has also been a devastating loss to the nation's economy. And that impact, of course, is calculated by the difference between what was expected had the pandemic not happened and what actually did happen because of the pandemic. So the impact economically, first and foremost, clearly affects our healthcare system. And as Dr. Abbo talked about, the impact to her hospital was enormous. There are systematic shortages in staffing. There's bed turnover issues. There's management issues. It affects the entire healthcare process, so that not only is the quality of care less per COVID patient as the numbers accumulate and you have too many patients to deal with, but you have less ability to manage patients with other diseases and other problems, as we've seen repeatedly in this pandemic. So that's a direct thing. Less people are aware of the DALYs, which is the disability associated life years from long COVID and other post-infectious syndromes that we're having. And we're having a tremendous economic impact because of this long COVID. We've seen the DALYs, the disability associated life years, swerve up dramatically. And the higher those DALYs are, the less the GDP is going to be. So we have to see the interconnectivity of this disease on our economy as a critical component. So as we all know, we started to get an increase in the economy more recently, but that improvement has been uneven and it's not assured. The setbacks happen when we have COVID-19 waves fueled by variants, as we've most recently seen with the Delta variant, and it's fueled by high transmission. So anything we can do to decrease transmission is going to have an impact on all the One Health systems, including obviously our wellness, but less obviously and utterly important, our economy as well. Other things that impact: further vaccination delays, mounting debt levels, rising inflationary pressures. And this whole thing is even more complicated because of the uneven impact to low-income countries, low-middle-income countries, especially in comparison to high-income and upper-middle-income countries. And the fact remains that right now, in lower-income countries, COVID economic impacts are continuing to deteriorate and at a faster rate than for the rest of the economy. In fact, in terms of extreme poverty, it's been estimated that COVID-19 has pushed 150 million more people into extreme poverty. That means they're earning less than $2 a day. And these debt burdens and financial vulnerabilities have risen in many parts of the global economy, and that's going to make the overall recovery harder. Again, the new variants and further waves will further destabilize the economy, so we must prevent this. one of the key issues is variants. Let's talk a little bit about the science of variants. Why are there so many variants? Well, first of all, it's really important to realize that if you look at the SARS-2 virus, which is here, its normal intrinsic inherent mutation rate is lower than many other viruses. It's much lower than influenza and lots of other RNA viruses because it has a little bit of proofreading capability. But if the number of infections is high, then it's artificially raised and we have more mutations simply because it has more opportunities and more places in which it can mutate. And of course, variants happen if the variation that happens gives a fitness advantage to that particular virus variant. And they're in situations of high immune pressure, under vaccinated communities is part of that, or where you use really not as quality a vaccine, you actually have an immune pressure to form a worse variant. So you really want to get the highest quality vaccine at the highest possible levels in order to diminish that effect as a contributor to more mutations. And we also see some other things like the intermediate host issues and the founder effect, where one individual who's particularly contagious happens to be in a mass gathering setting, and then that particular individual's variant goes out of whack. So here's the most recent data on terms of the weighted estimate of proportion of the SARS-2 lineages in the United States. And you can see the huge shift from May, where Alpha, the UK variant, was dominant, to now, where literally 99.4% are Delta. And actually that's a little bit sneaky because Kappa is also a very similar virus found in India. And this one was also found in India as well. So you have to look at this with great care. Another important point is the Mu variant, which Dr. Abbo will tell you about, having discovered it here in Miami a few months ago, but it was overwhelmed by the Delta variant, which is so much more transmissible, even though this one is what we call an escape mutant. And we'll talk more about that later. Here, I'd like to invite Dr. Abbo to join me and discuss this particular slide, which looks like a comic, and it is, but it's also a profound set of truths, because vaccinations are really far better than having to take monoclonal antibodies, which are much riskier things than being hospitalized or death. And Dr. Abbo?
Thank you, Eileen. So one of the key messages is, I think as business owners and many of you who deal with patients, not patients, but employees and insurance, I would suggest that you start looking at your healthcare plans and the cost, the claims of these people who have not been vaccinated and ended up requiring acute care and hospitalization, including ICU care, due to COVID-19. As many as you know, 18% of our GDP is actually expended in healthcare, and it's our taxes that are paying for all this testing and all these vaccinations. And as we're trying to understand why people do not get vaccinated, I also tell them you need to understand the risk and the cost of getting this infection. Again, like Dr. Marty has been mentioning, vaccination continues to be safe, effective. We're fortunate to be in a country that provides free vaccines, regardless of who you are, legal or illegal immigrant, and with no appointment, you can just walk into any pharmacy and have a vaccine that is over 90% effective against the Alpha variant and still continue to work and continue to be safe in children and in adults and elderly. Monoclonal antibodies have been used. They're still under emergency authorization, and yes, they work, but it's not the same. They have a half-life of 28 days. They do not provide this long-term protection that the vaccines currently work. And we're going to be talking also about the boosters later on. But I think it's really important to look from the economic side, the cost of vaccination versus the cost of hospitalization and death for a now preventable disease.
Exactly. And let's talk about some of these other ways of preventing. Let's talk first about non-pharmaceutical prevention methods. They do work. They're very unpleasant many of the times, such as the school clothing and the workplace clothing. And the data from many studies, and this is one of the best ones that I'm sharing with you here, definitely says that definitely brought down infections tremendously. But that's very painful, and we need other methods. But I think it's notable that businesses, restaurants, cafes, and gyms accounted for most COVID infections in US cities, with 80%, interestingly, of the infections linked to 10% of the locations. So what was the difference between the 90% of locations that were not implicated and the 10% that were? That's really where the money is in terms of how do you keep a business open and not be part of the problem. Clearly, mask wearing was consistently effective, and most important is public messaging, so that people have, as Dr. Abbo so beautifully said, the right information from the right sources. That's really absolutely critical. In terms of the value of masks, first, I want to remind you that there's nothing new about wearing masks. Back in 1905, Dr. Alice Hamilton, yes, a woman, physician in the US, did a phenomenal study showing exactly why doctors and nurses in hospital needed to wear masks and reduce infections both to the patients and from the patients. And so studies since then, and more recently, specifically targeting whether or not masks are valuable or not, have been done both in animals and in humans. This is an animal study here in the Clinical Infectious Disease Journal of the Infectious Disease Society of America. And in this study, using hamsters, okay, they showed that masks greatly reduce the risk of infection, but more than that, wearing a mask gives you much milder disease. And that makes sense because the dose makes the poison, right? The dose makes the poison. If less virus gets into your system, it's less likely that you won't be able to fight it. So the more virus you get into your system, the harder it is for your immune system to fight that virus, okay? And now there's been a huge study in Bangladesh with more than 340,000 adults, again, very clearly. And here, of course, is a setting where people don't use masks consistently. They use all kinds of masks, et cetera. And even in that setting, masks work, period. Masks reduce transmission, and surgical masks reduce it more than most cloth masks. And this is Dr. Abbo's slide, and I was so happy to see this on the day that it happened. The joy that I felt watching Dr. Abbo get her vaccine, I cannot even begin to tell you. Dr. Abbo, would you like to comment on this?
I think that day we felt, I mirror it to how Neil Armstrong felt when he walked on the moon. It was such a breath of hope, right? To see everyone, from our respiratory therapists, our environmental workers, everyone getting vaccinated and given the opportunity. We had lines. We gave that day over 1,000 doses, and it was our first days. Our pharmacists were working nonstop, mixing and preparing. We had nurses who had not been in the front lines who had been administrators who said, I want to go and give shots. Everyone wanted to be part of this. It was really coming together after so many months fighting so hard for this disease. So it was really an honor I felt that it was really an honor to be vaccinated.
And I think that speaks volumes. And I know that Dr. Roldan had a similar experience when we began giving the vaccines at FIU. Just a tremendous joy that we were finally having something that was really going to help conquer the problem. If you look at this data here from our world data source, you can see who's getting vaccinated and who's not. And this is where it becomes rather sad when you look at where we are in the United States here compared to so many other countries. We're not where we need to be. And right now, 40.6% of the world population has received at least one dose. That's not necessarily the solution. You really need to get as high an efficacy as you possibly can. We've administered over 5.5 billion doses, but only in the lower income nations, only 1.9% of that population has received the vaccine. And we unfortunately or fortunately have to recognize that this is not a disease of one population. This is a global disease, and everyone needs to get up to that level of protection so that we don't have more variants and we don't have more problems. This is yesterday's data on the vaccine rates in the United States, you can see that of our total population, only 53.2% is totally vaccinated. That is simply inadequate. Okay. What about this? Well, again, it not only does vaccination reduce your risk of severe disease and death, which is the critical thing we want a vaccine to do, but the studies also show that you're much less likely to be hospitalized and you're much more likely to be asymptomatic if you do get the infection. So vaccines work, they very clearly work, and they're very clearly valuable. In terms of vaccine side effects, we know that vaccine side effects compared to SARS-CoV-2 infections, there is no comparison. They're virtually nothing in comparison to the risks from the actual disease. And you can look at it in terms of the risk ratios, as you see here in figure 3, or you can look at it in terms of the absolute risk of various adverse effects after vaccination. You can see, if you look in blue, that's the risk from vaccine versus the risks from the actual virus. Dr. Abbo, would you like to address a little bit about this slide as well? This is a really excellent study.
Yeah, this was recently published in the New England Journal, and I think the figure speaks for itself. As you can see in yellow, this is the risk if you get infected with SARS-CoV-2, and if you see in blue, it's really the risk of side effects from vaccination. So by all, if you look at all possibilities, acute kidney injury, having cardiac arrhythmias, a deep venous thrombosis or pulmonary embolism, heart attacks, brain bleeds, intracranial hemorrhages, right? Having myocarditis, which was one of the concerns in the younger population, or pericarditis. All of this are much higher if you get COVID than if you get the vaccine. And that, to me, it's a key message for people who are still hesitant. I think just showing this figure to me speaks for itself. You really need to understand when you're saying, I'm scared of getting the vaccine, what I tell people is you really should be scared of getting SARS-CoV-2 and developing a COVID-19.
And remember, something like the myocarditis, which is the only one that really has any significance here, the reason for that is the same underlying biological reasons as you get myocarditis from the virus, except less, right? Except, you're still responding to that. So someone that gets myocarditis, which is, by the way, totally treatable and manageable from having had the vaccine, would most likely have had a much worse myocarditis. That's an indicator that for them, the SARS-CoV-2 virus would have been far more devastating. Okay, in terms of the boosters, lots of studies now showing why it's a good idea, and there are reasons to believe that that third dose is really valuable. I'm not going to get into all the science of that because we've already been talking too long, but the bottom line is that a third dose against the Delta variant does give a much higher rate of protection. And so we are going to be moving in that direction. That's the reason that Israel, Germany, France, et cetera, have already moved in that direction. And I think it's important to look at the reality of what people are dealing with. They have their priorities all mixed up. They're not understanding that in fact, masks give you freedom to have an open economy. In fact, the vaccine gives you freedom to have more relationships with your loved ones with less risk. So I think that this is a really poignant slide. And this is one of my favorite slides, which is the point that no single intervention is perfect at preventing spread. That's why we want to use as many interventions as possible. Yes, you can have a breakthrough from the vaccine, but overall, you've got a very nice layer of protection from that vaccine. In addition, masks also, you can, another mode of things. And then all the things in between, some of which are shared responsibilities and some of which are personal responsibilities, all need to be taken into consideration in order to have the best possible outcome. And at this point, I will switch back to Dr. Abbo.
Well, thank you, Dr. Marty. It's actually me. I have, thank you, Lily and Dr. Marty. Thank you so much for a great, great presentation, actually touching upon every single aspect that COVID-19 has actually impacted our world. Dr. Abbo, I'm just gonna ask just a few questions before I turn it over to my colleague, Dr. Stewart, for the questions that we have from the participants. Dr. Abbo, you have been at the front line treating thousands of patients since the beginning. Obviously, in a place like Jackson Health System being a safety net, patients, every single patient ends up really at the emergency room. How would you describe the patients that you were treating, let's say way back in March, versus the patient you're treating now? And a second part to that question is very important, again, as to not wanting to be impacted by COVID-19 because of the post-COVID syndrome, which patients have then revisited and been readmitted to the hospital.
So thank you, Eneida. The first part is back in March and April of 2020, we were seeing a much older population getting very sick fast. These were the elderly, people over 80, 85 years old. Then we had the people who were in their 60s and 70s who will come in, some of them from nursing homes, some of them from home. As you know, Jackson covers a very wide part of the county. So we had Jackson North, we had Jackson South, and Memorial. And we were seeing different demographics in different parts of the county. Then as the summer started, we started seeing a different mix. We started seeing children who were going to summer camps or to school and coming back home with mild or asymptomatic and then infected the grandparents and then the parents. At some point in one of our hospitals, we had both grandparents in the hospital dying. Mom was hospitalized with, needed a cardiac surgery at another hospital, and dad ended up with COVID, critically ill in the ICU with an autistic child at home alone. And 3 or 4 family members passed away. It was just horrific to see these scenes. As the pandemic has evolved, and as we have seen with Delta, most of the elderly population were the first in line to get vaccinated, right? We started vaccinated based on risk, and they were all jumping in line, fighting, calling and texting me like, hey, I need my vaccine, please get me the vaccine. At some point, people thought we were dealing with drugs, right? Like, hey, you have an inside, get me in line first. And we're like, no, we're gonna get you when it's your turn. So we started vaccinating the elderly, and they have more protection. They have been more compliant with social distancing, with masking. Then we start seeing a younger population coming in June, July, and August, which are young Invincibles. These are the people who feel that they don't need to buy health insurance. These are the people who feel like they can go party and they don't need to wear a mask and they don't need to get vaccinated. And we have seen a wide range of distribution from people in their 40s and 50s to people as young as 19-year-old coming in with destroyed lungs, and we need to airlift them for a lung transplant. We're seeing our ICUs, over 90% in the ICUs are unvaccinated young people, and then a smaller percentage is immunocompromised people, transplant patients, oncology patients who unfortunately were vaccinated, but some of their family members did not. So I have transplant patients who tell me, my 19-year-old daughter didn't want to get vaccinated. Boom, she got COVID, and then she gave it to me because the transplant patient did not mount a good immune response. So people need to understand that when we make these choices, is your social responsibility, just like Dr. Marty mentioned. Every part of that Swiss cheese model, it's our responsibility. You're doing this for yourself, and you're doing this for your family and your community. And now, again, August, which has been the worst part, has been seeing young children in the intensive care unit requiring extracorporeal membrane oxygenation, newborns, 1 day of birth and within 7 days getting intubated, where we have no clinical trials in this population, and you're really trying to figure out what is the safest treatment in someone who's early as 7 days of life with this terrible disease, and what will be the long-term consequences of this virus, like you just mentioned. So I think the second part of your question was the long COVID syndrome. What we know from some of the studies is that over 80% of the people who have COVID end up with some sequela, whether it's fatigue that lasts for months, blood clots, people have brain fogs. Most of the people who had COVID, highly intelligent, very, professionals, tell me, oh my God, I couldn't think straight for several weeks. I'm finally getting back to myself. And I'm seeing now with Delta wave, people have been calling me like, I've lost 10 pounds, I've lost 15 pounds. So I think, yes, it's great if you're trying to lose weight, but I don't think it's the most effective strategy, right? So people are getting quite sick. And like Eileen mentioned, the Delta variant, it's way more virus, way more transmissible, and we're seeing people getting sicker faster. It used to be 14 days, 10 days. Now within 3 to 5 days of exposure, people come in, they're okay, and then they crash, they need oxygen and they need intubation very, very quickly. So the virus has changed, and it's transmitting more like chickenpox than it was transmitted like a flu or another respiratory virus.
Excellent. That is so true. Dr. Marty, you touched upon the industry as far as business is concerned. And obviously, we all know that just a few weeks ago, probably I think it was last week or so, that the FDA already approved the Pfizer vaccine. And obviously, that has regulatory implications across the business sector. So how do you see as lessons learned from this journey of being EUA approved and then going into the full approval with the FDA? How would businesses react? Obviously, there's a lot of regulatory and social aspects that are implicated. So what is your opinion now that the FDA has approved the Pfizer?
Well, first of all, it was very appropriate to fully approve the Pfizer vaccine. There have been billions of people who've had this vaccine, and we know that the data shows it is incredibly safe and efficacious. In fact, both the Pfizer and Moderna have safety and efficacy ratios like we've never seen before for any vaccines. And Florida has traditionally been very good about mandating vaccines for all kinds of settings, particularly educational settings, including universities. And the truth is, we ought to honor that tradition. This is a fully licensed vaccine that deserves to be mandated for appropriate settings, and appropriate settings include workplaces because ultimately it's going to help bring down. Dr. Abbo spoke very eloquently about the insurance aspects. That's part of it. If I were an insurance company, I would absolutely up the rates of people who are unvaccinated, because just like we up the rates for smokers or anybody else who takes unnecessary risks, these are people taking unnecessary risks, not only to themselves in this situation, but they're also causing unnecessary risks to your business and your community. So vaccine needs to be mandated and really needs to be mandated right yesterday. And why it isn't, I have no idea, other than things that have nothing to do with either science or what's best for the economy. Because what's best for the economy and what's best for science and what's best for medicine is that this vaccine be mandated.
Absolutely. One last question, and I want to actually open it up for both of you. There's been a lot of confusion in actually the nomenclature and the usage of the booster versus third dose. And we get this, as you know, we do have our vaccination site, and we also have the testing sites, et cetera. So we've been on this, rolling up our sleeves. And yes, Lily, we were all there. I look at Eileen, we were all there because, as you know, FIU has a footprint in Italy, in Genoa, and has a footprint in China. So we were rolling up our sleeves very, very early on as this disease impacted our country. But there's been a lot of confusion. I want to get my booster or I want to get a third dose. Very few individuals use the word third dose, which is the correct use of what we're doing now with both Pfizer and Moderna. There's been a lot of confusion at the upper level of the leadership and scientists in our country, really arguing whether the booster is necessary, because the booster, again, is for the non-immunocompromised. There's now even surfaced whether it's only going to be Pfizer, because we have learned, or clinical studies may have shown that Pfizer reduces the antibody immunity. And then again, what is that immunity? What does that mean versus a Moderna that can hold the immunity longer? I know it's a very long-winded question, but it's for both of you, and then we'll pass it on to the
I'd like to tackle this right away in certain things. First of all, the terminology is all over the map. There's reasons why the terminology is all over the map. Yes, when the EUA came out in mid-August, that individuals who had underlying conditions such as transplants that were giving them drugs that didn't allow them to have as good an immune response needed a third dose. That was really crystal clear as to the reasons for that. In terms of the rest of us who may have mounted an excellent response, the questions are multifold. As first of all, there's one issue, one way of looking at it is, should it have been 3 doses anyway? Because that's how we give a number of vaccines anyway, like hepatitis B, for example, is a 3-dose vaccine. And that's still a little bit debatable. The next issue is whether or not there truly is a drop in antibodies that is significant and that we really do or don't need to boost. Because, for example, now that I've had a number of patients that I have seen myself who fit into the category of another, time for another dose, you see almost right away, and when I mean almost right away, I mean within hours, a rise in antibodies after that third shot. And that's not because they're forming new cells, because new cells take a long time to form and make those antibodies. That means that there were memory cells there that simply had gone to sleep and said, oh, I don't need to do anything. There's no virus around. All of a sudden you give them the third shot and those numbers go up very dramatically. So there's questions about that aspect of how we're measuring. The study on Moderna that came out that you were alluding to is a study that came out pre-Delta. So it doesn't really totally reflect the situation in terms of Delta. And, but nonetheless, both Pfizer and Moderna have handed in all their data to the FDA now. It took a little longer for Moderna to do that. And the FDA in the United States has traditionally tried to be extremely thorough in how it answers these questions and when it makes its decisions. It seems painful to us to watch the process, but ultimately their goal is to do things right the first time. Dr. Abbo?
Yeah, Dr. Abbo, and also can you comment on what is the best test, if there is a best test, to really test immunity? Because we have seen it here in our clinics. We are running a small study on both Pfizer and Moderna and post-immunity, and seeing it also now as we are administering the third dose to the immunocompromised. So what are you seeing in the front lines as far as the test, if there is such a thing?
Sure. So the test that has been approved by the FDA most recently, about 6 weeks ago, is the orthovitrus. It's the only one that not only measures your antibody, but measures the neutralizing activity, right? How good, how protective it's going to be. Because people were already going out, commercial labs, and got really confused. First, we got instructions from CDC saying, do not check antibodies. Of course, everybody went and checked their antibodies. And some of the commercial labs were actually looking at the nucleocapsid antibody, not the spike. So they were looking at antibodies from natural infection. They got the vaccine and they were calling me like, I have no antibodies. I didn't respond to vaccine. I said, which test did you get? Oh, I have no idea. So when we look at first, you need to know which test you're getting. Otherwise, you're going to go in panic mode unnecessarily. The orthovitrus, we were just finishing the validation and we're about to implement it. We have at the university and we have at Jackson the test available. I'm sure FIU and Baptist will follow as well. I don't know about commercial labs, what LabCorp and Quest are doing or other of these testing sites. But it's really going to be a game changer because we're going to be able to not just say, hey, you have a number, is 12 better than 20, but really how good is your neutralizing activity? And do you really need a booster or that third dose, and how beneficial it would be? In the immunocompromised host, we know that there's a very wide definition of what it's immunocompromised, right? If I am taking rheumatological drugs, or if I have Crohn's disease and I need to take certain medications, other people say, hi, I'm on dialysis. What we know from all those groups is that the highest risk were solid organ transplant patients and some of the bone marrow transplant patients. They really, because of the medications that we give to try to maintain, avoid rejection of those organs, some of them were not responding as effectively. And that third dose has been like #1 priority. Get them in there because they really, really are the most vulnerable. And then when they get COVID, they get very sick and die. So I think that has been the priority. The data from Israel and from other countries, I think, is showing that in other populations, yes, those antibody levels decline, the activity, the neutralization also declines, and we are seeing breakthrough infections. We are seeing people who are getting breakthrough infections and getting sick. They're fortunately not dying. They're immunocompetent people with breakthrough infections get pretty sick. They're stay at home. And again, the vaccine is working against preventing death, which I think it's extremely important to highlight. When people tell me, oh, but I still got the vaccine, I got infected, I said, yes, but you didn't die. You didn't end up with a ventilator in an ICU, not seeing your family for several weeks. So I think that's still a key message. And I think Eileen has presented the data beautifully. And I hope that if you have more questions, we can answer them. But
Absolutely. The data is the data, is to follow the science. So at this time, first of all, thank you again. Thank you so much to both of you for this incredible presentation and the time and presenting really the evidence base and what we're really facing on a day-to-day with this with this disease. I'm going to pass it now to my colleague, Dr. Stewart. Dr. Stewart, he has been monitoring some questions, and we have just a few more minutes before we end. Dr. Stewart, are you there?
Yes, ma'am. Can you hear me?
Yes, we can.
Thank you for the wonderful job. I have a number of questions to ask, and we will get through them as quickly as we can. So whoever wants to jump in, let me first say that one of the positive comments is how great the statistics and so forth have been. We are recording this, and it will be on the Chamber's website for any of those who would like to have this data and so forth. The first question is from a college football fan who this weekend was watching college football and News at the Beach and said it was hard to miss the few people wearing masks. Do you anticipate another COVID-19 surge in the 3 weeks due to Labor Day weekend? And if so, what will it look like? And then also, have we seen the peak of deaths in this latest surge?
So, Dr. Abbo, I see you want to answer as well, but look, there's no question that it's all tied to behavior. You know, when Dr. Abbo spoke about seasonality, she phrased it in the right way. It's not about the seasons per se, it's what we're doing in the seasons, okay? It's our behavior of getting together and exchanging whatever pathogens we have that lead to new spikes. So absolutely, the football games and the other gatherings that have happened with unmasked individuals, especially the unvaccinated, is going to show up 2 weeks, 3 weeks from now as hospitalized individuals. There's no question about that. I'll let Dr. Abbo go on.
Yeah, I'm having PTSD and flashbacks from a year ago when we saw 4th of July and the parties, and then we have Labor Day and all the Jewish holidays. We just celebrated Rosh Hashanah. A lot of people congregated in houses of worship and in, dinners, etc. So I think as schools opened, and some schools have mandated, others have not, as some parents are being extremely responsible and not sending their kids to school if they have symptoms, but others are not. I've heard of parents who are sending their kids, we just thought it was a runny nose, and the runny nose ended up being COVID. So I think all those variables still play a role. I want to stay cautiously optimistic, but we all need to be very realistic. And I also fear that Florida has seen this surge and the rest of the country has not yet. But the Northeast, around October, November, we'll start seeing this wave, the impact of the Delta wave that we had just seen because of exactly the behaviors that we have been discussing today.
And in terms of the deaths, which was also part of your question, if you recall the slide that Dr. Abbo showed that was compiled by the public health school at FIU, you can see that, we don't yet know the total number of deaths from today. And we won't know it for quite a while. That's just the way it is. And yes, anytime you see an increase in cases, some percentage of that is going to be hospitalizations, and some percentage of that will end up in deaths. But I'm also cautiously optimistic about Florida. We may have saturated the more risky population of Florida at this time with Delta, but who knows which variant may be coming up next. And we certainly are nowhere near where we want to be in terms of safety.
Thank you both for those two answers. The next question you both have touched on a little bit, but please provide updates regarding the COVID vaccine and those people who are immunosuppressed and immunodiseased to vaccination, the short-term and long-term effects, if you would, please.
I think so far what we have, the understanding that we have is that the vaccines are working. They are effective. Even in immunocompromised patients, we have not seen flares of immunocompromising conditions. I got a question this morning, if somebody has, ulcerative colitis and they get the mRNA vaccine, is there any risk of flares? No, we have not seen that. The risk of flares is with COVID, not with the vaccine. In the transplant and the oncology population, vaccination is extremely important, and getting that third dose is as important, and they can get that third dose within 28 days of the second dose. That's very different from the general population, where they're recommending 6 to 8 months. I think the immunocompromised after 28 days is really important that they get that third dose. There's evidence to show that their antibody titers go up and they're more protected. In that immunocompromised population, it's extremely important that they continue to use all the other measures, masking, physical distancing, and making sure their family members and close contacts are also wearing masks and getting vaccinated. Again, it's like, I say this all the time, this is like driving safely and wearing your seatbelt. If you wear your seatbelt but you're speeding and driving drunk, the seatbelt is not going to protect you enough. So it's a combination of things that we need to do, whether you're immunocompromised or immunocompetent, that's going to help us end the pandemic.
Sort of in line with that question, we got a question, Doctor, to you. Some people at work claim masks limit their ability to breathe, citing conditions like asthma and so forth. Are there conditions where you believe wearing a mask is contradicted?
No, actually, there have been several studies, and University of Miami actually published a paper on this, looking at even an N95 respirators and looking at your capacity. I work out, when I go and work out indoors, I wear a mask, and when I work out outdoors, I don't. But there has been no evidence that masks will limit your capacity to breathe, even in people with COPD or other conditions. So far, no evidence. So it's safe.
Very good, thank you. The next question, is the vaccine adding to the mutation of these variants?
The vaccines that we have in the United States are decreasing the risk of variants tremendously. There is some question about the inactivated vaccines and whether or not they were permissive of the formation, because there was still so much transmission. And it really boils down to transmission. And that's why you want the highest possible efficacy of the vaccine, so that you reduce both transmission and disease in order to reduce the possibility of having a new variant.
This next question I'm going to kind of summarize, talking about vaccines in general. It usually takes plus or minus 5 to 15 years to develop, and that we've developed this vaccine in less than a year. Could you guys comment a little bit about that? And
I'm jumping right in on that.
Okay, thank you. I knew you would.
Look, the first time that we started talking about messenger RNA vaccines and trying to create them was 1989. This is not new science. This is something that we've been developing over decades. And in fact, Pfizer already had in its line of production a flu messenger RNA vaccine before the COVID outbreak. It just hadn't gone through clinical trials. Moreover, there was already a patented messenger RNA vaccine in 2017 against MERS, the one I showed you earlier, which is the Middle East Respiratory Syndrome, but because there were so few cases, nobody poured the kind of money that was poured in by Operation Warp Speed in order to conduct the massive clinical trials in the time frame. So the minute that China released the sequence of this virus, my colleagues at NIH were already taking that sequence and modifying the existing patented vaccine for MERS into what became the Moderna vaccine, using the concept that had already been patented of putting in 2 prolines to stiffen the spike. So and tons of research had already been done on animals. Now all they needed to do was repeat that work with this new version. Really, it was just a new version of an existing vaccine that had already been tested. So it seems very fast, but what made it fast was the money. So that things that normally would have taken years to accomplish were able to be the same quality of work was done in much less time. That's the key message. Money made the difference in getting it out sooner, not a problem with the science. And if you're talking about the J&J, which is an adenovirus vectored vaccine, a non-replicating adenovirus, that came out from, the first idea of that was a friend of mine, Nancy Sullivan at NIH, who developed an adenovirus vaccine against Ebola. And Peter Jarling and Tom Geisberg, was my graduate student, are the ones that were able to verify that that was a very effective way to make a vaccine. That was the first time we ever had a vaccine that worked against Ebola. And then later on, the Canadians came up with a different viral vector. There's been like when it's the vesicular stomatitis virus as the vector, but that's not irrelevant. The point is, we already knew that that would work as a good way of providing vaccines. There's many other vaccines that use viral vectors. The dengue vaccine that was created by Sanofi uses a viral vector. Japanese encephalitis virus uses a viral vector. We've used yellow fever as a viral vector. There's nothing new about that technology.
I wanna say something, Dr. Marty. I mean, she's always brilliant. Two things: the money actually and Warp Speed help, but also we have a pandemic. In many illnesses, you need to have the right number of people to test a drug or to test a vaccine to make sure it works. Here we had millions of people infected around the world, and for the first time in a country where in a world where there's so much discrimination, when there is so much injustice, we have a fair vaccine that has been studied in different groups of different backgrounds, different colors, different kinds of people around the world, and we're all having the same immunologic effectiveness. So with so many inequalities, we have equal immunologic response, whether you're Black, Latino, or white, or Chinese, or Asian, we all have the same high response to this vaccine. This is really unique. It's well studied and really well shown by science. And I think this is one of the first times in the world that we can prove that.
Thank you both for that. I'm getting questions even by text. You guys are on fire right now. Let's try to get a couple more in. This one says it doesn't look like there will be mandates on vaccinations or mask wearing in Florida or the US. What strategies should we consider in running our businesses which strike a balance between keeping people safe and keeping our businesses and economy going, especially with what seems like a continuing process of surge and abatement?
Eileen, you want to go first?
No, you go ahead.
Like someone recently told me the genie is out of the bottle. I am the kind of person who always try to see the positive and stay optimistic. If you're a business owner, if I was the business owner, yes, you cannot mandate it, but you can strongly encourage it. And the way we're doing it in the hospital is we're enforcing it. We need to protect the patients. We need to protect the healthcare workers. If you're a business owner, it's your business. It's in your hands to decide what is right and educate the people that work for you and that are in your business. It's in your best interest to protect your employees as well, right? You need that workforce. In order to keep the business is not the building. It's not the brick and mortars, it's the people. So protecting the people and ensuring that they understand how the virus gets transmitted and you're protecting them, I think it's the best win if you want to maintain the economy open.
I will add something, and thank you, Dr. Abbo, that's fantastic. The bottom line is people respond best when they want to respond to what you're asking them to do, right? It's much harder, you can hold a gun to somebody and they'll do what you want while you're holding the gun, but the minute you take the gun away, they do whatever they want. So it's much better if you can convince them that they want to take a particular action. And I think that's what's underlining what Dr. Abbo was saying.
Two quick final questions. Someone completed today the Z-Pack for a sinus infection and their symptoms are now gone. How many days do they need to wait before taking the booster shot, the booster vaccine?
None.
None? Okay. And then the final question, this will be our last question of the day. At what point should we be considering a booster for ourselves? And you guys have all touched on this, but just a good one to end on. Should we wait up to 8 months so that it'll last longer, or should we get it as soon as possible?
That's a very hard question because ourselves, we're all a very heterogeneous group here. I have people in the audience who may be 25-year-old, and you have somebody who may be 75 years old. So I think it depends on when you got that first dose. It depends on your immune system, your your risk factors, and again, the data around the world is showing between 6 to 8 months. I tell people who are frontline healthcare workers intubating patients every day in the emergency department and in our ICUs, you should get it sooner, right? You're at high risk, you're exposing yourself perhaps than someone who's working from an office or working from home who may have a lower risk, but depends on your individual risk factors, your behaviors. I don't think there is science that says you need to get at 6 versus 7 months yet. I think that information will be upcoming, and I'm sure Dr. Marty has some other information.
Yeah, no, the data is all over the map on exactly when the best time for giving the boosters. And remember, we've only been studying the impact of the vaccine on the immune system since we've had the vaccine, not even since the virus outbreak started. So let's just try and see what happens over the next few weeks. I think it's prudent that if you think your immune system has slipped, that you should definitely increase your non-pharmaceutical interventions.
Well, thank you. First of all, I want to thank everyone. I want to thank our sponsors, United Home Care and FIU-Health. United Home Care has a video that they want to share real quick on their upcoming Claude Pepper Award. So let's roll that video, please.
United Home Care announces the Claude Pepper Award honorees: Thelma Gibson Community Service Award, Carlos R. Fernandez Guzman, Pacific National Bank, Corporate Social Responsibility, Greater Miami Chamber of Commerce, All in Miami, number 41. Media Award, Gary Press, Lifestyle Media Group, Entrepreneur Award, Irina Villarino, Las Vegas Cuban Cuisine Restaurant. Education Award, Dr. Ranja Dwara, Medical Director, Wien Center Hispanic Leadership Award, Lilian M. Lopez, South Florida Hispanic Chamber of Commerce. Innovator Award, Pascal J. Goldschmidt, Claremont, CMO, Lennar Corporation. Dean Emeritus, UM Miller School of Medicine. Corporate Service, Jesus Quintero, JQ Group of Companies. Advocacy Award, Placing Seniors First Monument, Barbara E. Sanchez. Philanthropy Award, Remedios Diaz Oliver, President and CEO, All American Land. Community Builder Award, Michael Finney, Beacon Council. Congratulations to the Claude Pepper Award honorees.
Well, I want to give a special thanks to our moderator and my colleague, Dr. Roldan. Thank you for your great job. Dr. Abbo, Dr. Marty, amazing webinar today. I apologize that we didn't get to all the questions, but thank you for all three of you for your great time today. I also want to announce that this is phase one. Our next webinar that we'll announce shortly will be on children pediatrics, and then we'll hopefully do a third one on geriatrics. So thank you all for being here today. One other quick reminder for those of you that might be interested in our Greater Miami Chamber of Commerce Healthcare Committee, our next meeting is on October 20th. Thank you for everyone being here today, and stay safe, and we will see you with our next webinar.